Welcome to the Hope Natural Health Podcast. I'm Dr. Erin Ellis, your host. On this show, we discuss all things health, hormones, and happiness with a little side of this thing called life. Dr. Eric Osansky is a chiropractor, clinical nutritionist, and a certified functional medicine practitioner who has been helping people with thyroid and autoimmune thyroid conditions since 2009. He is the author of the books Natural Treatment Solutions for Hyperthyroidism and Graves Disease, the Hyperthyroid Healing Diet, and Hashimoto's Triggers, is the host of the Save My Thyroid podcast, and the creator of the Gut Healthy Thyroid newsletter. Dr. Osansky was personally diagnosed with Graves disease, and after seeing how well a natural treatment approach helped with his condition, he began helping others with thyroid and autoimmune thyroid conditions. I'm very excited to have this expert on thyroid disease to the show. So welcome, Dr. Eric.
Thank you so much, Dr. Erin. Excited to be here.
Great. Well, before we dive into all things thyroid, tell me a little bit more about your background and really how you got into what you're doing. Share a little bit about your health journey.
Sure. So my background's a chiropractor, and I was just practicing regular chiropractic for a number of years, and then I was at the stage of my life where I wanted to lose a little bit of weight and was dieting, detoxifying, exercising, overtraining, just to be honest, and was losing weight, which was the goal. But I was 182 at the time. My regular weight, like 165, 170. But eventually I got down to 140, so a lot lower than I wanted to. But that's fast forwarding ahead. I mean, pretty much one day I was walking around a retail store, took my blood pressure at one of those automated blood pressure machines, and my blood pressure was normal, but my heart rate was around 90 beats per minute. Thought maybe it was just because I was walking around and maybe not fully at rest. And so I took it the next few days manually. It was anywhere between 90 and 110 beats per minute. Realized something was going on. Saw a primary care doctor, got diagnosed with hyperthyroidism, then went to an endocrinologist, diagnosed with Graves. And at the time, I didn't really have much experience, really no experience with hyperthyroidism and Graves. But as a chiropractor, when taking my continuing education credits, I always took nutrition and functional medicine courses, and I did take a couple of functional endocrinology seminars, which did touch upon hyperthyroidism. It focused more, of course, on hypothyroidism, Hashimoto, since they're a lot more common. Mm-hmm. But I knew there was hope, that there was an alternative way of addressing Graves. And so even though I was a little bit skeptical, because again, I didn't know personally anybody who reverse Graves naturally, but I decided that I would, try to address the cause of the problem, and of course, change my diet, change my lifestyle. And long story short, I was able to restore my health and avoid radioactive iodine surgery, which are commonly recommended to those with Graves. And then since then, this is 2009, since I've been helping others with hyperthyroidism as well as some people with Hashimoto's.
Wow. So what did you discover was your root cause?
Well, as you know, usually there's multiple imbalances, multiple causes, but I definitely think stress was a big factor. Again, not just emotional stressors, but I mentioned I was overtraining. I wasn't listening to my body. And I definitely think that was at least a contributing factor in dragging down my immune system and my adrenals.
Yeah. There's definitely more than one thing, and it's usually like a compounded effect. One thing affects the other, and then your body's like, whoa, stop it.
Yep.
So for the listeners that might be feeling confused, can you break down the basics between like hypothyroidism, Hashimoto's, hyperthyroid, Graves? There might be some new terms there that some of the listeners might not be familiar with.
Yeah, of course. So many are probably familiar with hypothyroidism. That's when, so let's start with TSH. TSH, thyroid stimulating hormone, is a pituitary hormone that communicates with the thyroid. And then you have the thyroid hormones. You have the main thyroid hormones that can be measured are T4 and T3. The thyroid gland produces mostly T4 that converts into T3. So with hypothyroidism, you get the thyroid hormones low, or on the lower, they could be on the lower side, but within the lab range. Sometimes they're overtly low. But either way, when they're low on the lower side, the pituitary communicates to the thyroid gland to produce more thyroid hormone. And as a result, you get an increase in TSH. So with hypothyroidism, you have elevated TSH, thyroid stimulating hormone, and then T3, T4 on the lower side. And then with hyperthyroidism, it's the opposite. Hyperthyroidism, you have too much T4 and T3. And as a result, the thyroid gland is, or I'm sorry, the pituitary gland is telling the thyroid gland, let's stop the production of thyroid hormone or at least slow it down. And so you have lower amounts of TSH, lower amounts of that thyroid stimulating hormone. So with Graves, it's typically undetectable. And most thyroid conditions, both hypothyroidism and hyperthyroidism, are autoimmune in nature. And so with Hashimoto's, you have the immune system attacking the thyroid gland, and that's what causes the thyroid to become, the thyroid hormones to be low over time. Whereas with hyperthyroidism, you have the immune system attacking the TSH receptors of the body, which causes a stimulation of the thyroid, causes an excess amount of thyroid hormone. And yeah, so in a nutshell, that's the really the difference between hypo and hyper. There's different symptoms, like when you have low thyroid hormone, some of the common symptoms would be fatigue, weight gain, brain fog, uh, brittle hair, sometimes depression, constipation, like everything's slowing down, coldness. With hyperthyroidism, I mentioned I dealt with the tachycardia, increased resting heart rate, uh, tremors, heart palpitations, anxiety is common, and that could lead to insomnia, hair loss. You can see hair loss with both hypo and hyper, increased bowel movements. Again, I mentioned how I lost a lot of weight, which is definitely more common with hyperthyroidism. A lot of people with or a lot of people with Graves have what's called thyroid eye disease, when the immune system attacks the tissues of the eyes. So yeah, so that's kind of a brief summary of the differences between hyper and hypo and Hashimoto's and Graves.
And hypo is more common than the hyper, correct?
Yes, definitely.
Yeah. And what I've read and what I tell people is most, like the Hashimoto's is probably the most underdiagnosed thyroid condition there is. There's probably so many people walking around with Hashimoto's and they don't even know that they have it, because the antibodies typically aren't ever tested unless, there's something that somebody's missing. But I mean, I find Hashimoto's all the time and people didn't even know they had it. Have you seen that clinically?
Yeah, oh, definitely.
Yeah.
Yeah, you're right, because people could have those antibodies for like 10, 15
Mm-hmm.
years, before the thyroid is affected. And
Yep.
so you're right, it is frequently misdiagnosed.
Yeah. So you focus heavily on triggers, and you touched on some for you as far as the root cause. But what are some of the most common root causes of hyperthyroidism and Graves' disease that you've uncovered in your work?
Yeah, so I mentioned stress, not just in my
Mm-hmm.
situation, but in a lot of people, if not most of the people I work with, that's at least a factor. Food could be a trigger as well. So foods, most functional medicine practitioners know that gluten can be problematic in different types of autoimmune conditions, including Hashimoto's as well as Graves. Infections in the literature, and I've also seen in practice like H. pylori being a potential trigger, viruses during the pandemic when
Mm-hmm.
2020, 2021, we definitely had
Mm-hmm.
an influx of people with hyperthyroidism. Epstein-Barr, could be a factor. And again, this is also in the literature for both Graves and Hashimoto's. And then, of course, we live in a toxic world, so certain environmental toxins and toxicants can also be a
Mm-hmm.
potential trigger and lead to the development of a condition like Graves.
Yeah, my trigger. So I had hypothyroid for, I don't know, since I discovered it in med school, and I think it was just due to the stress of being in med school. And I had been seeing a naturopathic doctor, so had my antibodies tested, and they were negative, negative, negative. And then in September of 2020, so 6 months after the pandemic started, I threw
Mhm.
an antibody response. And I had the virus in, I think, July of 2020. So that's interesting you say that you've seen more uptick of autoimmune post COVID. Interesting, because that happened to me.
Yes. Mm-hmm. Yeah.
Yeah.
Yeah, definitely. Yeah.
I didn't know it was the virus per se. I thought I was chalking it up to stress because it was a very stressful, time when we're on that certainty. And I was running a business and like, what's going to happen? Nobody's going anywhere, right? So that's what I chalked it up to. I didn't think anything about the virus. Interesting.
Yeah. Well, like we said, I'm sure it was a combination.
Yeah, it
Like
could have
again,
been.
it's not just
Sure.
one thing. The virus could have been the straw that broke the camel's back, with the
Yeah.
stress being a huge contributing factor, or maybe even a more significant factor than the virus.
Yeah, for sure. So, in your practice, how do you see the connection between gut health and thyroid autoimmunity? And why is healing the gut such an important step in addressing these conditions?
Yeah, great question. So there's what's called the triad of autoimmunity, also known as the three-legged stool of autoimmunity. And so, in order for autoimmunity to develop, you need there's a genetic predisposition, which we can't do anything about the genetics. I mean, we could change expression of genes, but we of course can't change our genes. But we can address the triggers, which we briefly mentioned, and then so that's the second component. One or more environmental triggers. The third component is that increase in intestinal permeability, which is the medical term for a leaky gut. So that's one of the main ways that the gut autoimmune connection. If you have that leaky gut, that's definitely a factor in development of autoimmunity. And then, I mean, most of the immune system cells, like 70 to 80% of the immune system cells, are located in the gastrointestinal tract. So, yet another reason why you need a healthy gut in order to have a healthy immune system.
I didn't. Can you say that? What was the triad called again? I've never heard that.
Sure, the triad of autoimmunity. So the three
Oh, okay.
components. Yeah. Yep.
And that was genetics, environment, and gut.
Exactly. Yep.
Oh, yeah. That's exactly what I found for mine. It's funny I'm doing this because that's when I decided last year, I was like, you know what? I need to get to the root cause of why, for my own health. Doctors are the worst patients. I'm sure you can agree. And I'm like, this is what I do on a daily basis for all my patients. I'm like, well, let me figure out what the heck's going on with me and like, why can't I heal myself? And guess what? I found, I don't know about genetic disposition for me, but as far as Hashimoto's, I don't know anyone in my family that has Hashimoto's, but like I had a huge environmental component. My gut was a mess. So very interesting. All that is like a big storm to create a big mess in your body. So
Yeah.
cool to
Agreed.
look at
And
it.
I didn't have any history of Graves in my family too. So there was
Yeah.
not one person that I know of
Huh.
that had Graves. So it's again, I think it's Institute for Functional Medicine is where I learned about that triad of
Mm-hmm.
autoimmunity, the three-legged stool. But you're right.
Mm-hmm.
Sometimes there's a strong genetic component, and then
Mm-hmm.
sometimes in working with someone, there's absolutely no family member
Yeah.
that they can recall.
Well, I mean, there could have been, but nobody's really tested for it. So my dad has hypothyroid, so I'm curious.
Yeah.
Maybe he has had Hashimoto's. He never even knew it. So,
Hmm. Very
yep.
true. Very true.
So many women, or really anyone, are told that medication is really the only way forward. So, from a natural treatment perspective, it sounds like you didn't do any medication. What are some of the foundational solutions you recommend for, patients with hypothyroidism that go beyond the conventional care of here, take this pill?
Yeah, and I mean, to be fair, there is a time and place for
Mm-hmm.
anti-thyroid medication and hyperthyroidism and thyroid hormone replacement and hypothyroidism, Hashimoto's. But we also need to remember that since most of these conditions are autoimmune in nature, we need to focus on the immune system. Uh,
Mm-hmm.
so, as far as foundations, I mean, of course, eating a healthy diet, whole foods diet, anti-inflammatory diet, ideally gluten-free diet, and again, blocking out time for stress management on a regular basis, getting sufficient sleep. I mean, many times you have to go beyond the foundations. I mean, yeah, that's definitely, I think, where people should start.
Mm-hmm.
And again, you might need to go beyond that and do some functional medicine testing to find some of the triggers and underlying imbalances. But yeah, I avoided the medication, but I also said that if I needed to take it, I would have
Mm-hmm.
taken it. I'm grateful I was able to avoid it, but some of the people I work with do need to take it.
Yeah. Yeah, agreed. I mean, I was on meds for a long period of time. I'm now off of them and feel like I've reversed my Hashimoto. So I'm going to ask you that. How often do you see people reverse their autoimmune thyroid condition?
I mean, a good amount of time if they follow the recommendations. As you know, the one of the biggest challenges is uh, sticking with the diet, trying to avoid common allergens like gluten, and just trying to get in a routine of block out time for stress management, and getting sleep in a lot of people is a work in progress. So yeah, I think, percentage wise, it's hard to say, but, I would say that 70-80% of people who follow the recommendations are able to get to the point where I would say that they're in remission, where their numbers look great. Of course, they're feeling good, and then, sometimes it's a struggle to get a person where like their antibodies are normal. That sometimes that could be challenging, but even in many of those cases, we're still helping them to avoid the radioactive iodine thyroid surgery, which again is, like I said, in the case of Graves, two of the biggest factors. And then again, Hashimoto's similar. It's obviously they're not concerned about getting radioactive iodine in most cases of thyroid surgery, but still, it's more of an immune system condition. And sometimes you could pull your hair out trying to get those antibodies back to where they're in a normal range. But again, for a lot of people, they are successful if they incorporate the foundations. And like I said, we usually need to go beyond that and do some testing to try to find some of the triggers.
Yeah, for sure. So you talked a little bit about diet, mentioned gluten. Would that be one or two specific nutritional or food-based strategies that you recommend? Is gluten one of them, or what are a couple others that you recommend for someone with Graves or Hashimoto's?
Yes, so pretty much with everybody, I recommend avoiding gluten. It could. There's some question about it resembling the thyroid and like there being a molecular mimicry mechanism. But even besides that, it can cause that leaky gut. It could be a factor in that increase in intestinal permeability. So yeah, a gluten I definitely recommend for everyone to avoid. Um, One of the more controversial, and I don't know what your thoughts are on this, but at least with hyperthyroidism and Graves, iodine. There's a lot of controversy with iodine,
Yeah.
I'm not against iodine. I'm not anti-iodine. I'm not one to say that you need to strictly avoid like all foods based in iodine, but in some cases, eating foods that are really high in iodine, like kelp, for example, at least again, in those with hyperthyroidism Graves, could be problematic. So I usually recommend just not, again, to completely avoid foods that are rich in iodine, but not to go overboard with a lot of shellfish and a lot of kelp, a lot of sea vegetables. So that's another area where, again, and it depends on the person. There are some people who could certainly get away with it, others who can't. The problem is we don't know who could get away with it and who can't when it
Yeah.
comes to the higher amounts of iodine.
You touched on why gluten with like the molecular mimicry to the antibodies, but why specifically do you want to watch iodine? What does it do to the thyroid?
Well, iodine is important for thyroid hormone production. And so with hyperthyroidism, we get an excess of thyroid hormone production. Now, again, sometimes taking iodine, and again, I don't know how deep you want me to get into this, but sometimes supplementing with iodine or even eating iodine-rich foods will kind of inhibit, like through like a negative feedback, thyroid hormone formation. But sometimes what I see is it'll have that opposite effect where, again, person will eat foods really high in iodine, or again, more times it's a supplementation than the food, where they'll take iodoros, really high um, iodine supplement or potassium iodide, and that would exacerbate the hyperthyroidism, cause worsening of the thyroid, the hyperthyroidism, and again, there is the potential of it exacerbating the autoimmune response in some people with Graves, even some people with Hashimoto. Certainly not everybody.
Yeah. Yep. Yeah. For me, I don't have any issues with iodine, but like gluten, that was one of the first things I took out when I found out I had Hashimoto's, and I didn't really know how much gluten affected me until, I would randomly eat it again because, I'm human. sometimes around. I'm not going to starve myself and I'll eat the gluten. But man, I tell patients even, they want to clean up their diet at all. I'm like, take gluten out. I'm like, it's probably the most
Yep.
toxic and most inflammatory food we have. It's going to help you in more ways than one. You probably don't even really know how much it's impacting you until you pull it and then you eat it again. So it was interesting that I didn't know how much it was, bogging me down. Like my thyroid feels mad when I have it. Like it's hard to explain, but it doesn't get swollen or enlarged or anything. It just feels mad. And then I feel super brain fog, like almost hungover when I haven't, obviously had any alcohol. It's just the gluten. I'm like, I gluten myself. But yeah, gluten's a doozy. So we talked a little bit about stress and that being like a main factor and a trigger for these thyroid conditions. And we know that it's a huge factor in most everyone's life. So can you touch a little bit more on how chronic stress like directly influences the thyroid function?
Sure. So one way is more so in hypothyroidism. It's a concern, and we'll talk about, it's a concern with Graves, but as far as how it could impact those with hypothyroidism is by affecting conversion of T4 to T3. If someone's really stressed out, cortisol is high, they're pumping out a lot of cortisol, that could have a negative effect of T4 converting into T3. And T3 is that active form of thyroid hormone. So that's one way it could have a direct effect on thyroid hormone, on the thyroid. But also, it could affect the gut and immune system in a few different ways. I mean, one, it just causes a dysregulation of the immune system, a pro-inflammatory state when you're dealing with not acute stress, but more so chronic stress. But then also, stress could decrease secretory IgA, which lines the mucosal surfaces of the body, including the gastrointestinal tract. And we just spoke about how important the gut is when it comes to the immune system. So when you have secretory IgA is important for protection. So when you have lower amounts of secretory IgA, you're more susceptible to infections, for example, which also could be a trigger. And also, secretory IgA, it's not a leaky gut marker, but when I see secretory IgA low, it seems that that kind of relates. I used to do a lot of leaky gut testing in the past, and every time someone had low secretory IgA, they typically had they usually had a leaky gut. But yeah, so if you're stressed out, that's going to affect secretory IgA. It's going to cause dysregulation of the immune system, potentially setting the stage or at least being a contributing factor in the development of thyroid autoimmunity.
Yep. It's usually what I call an obstacle to cure, and we can't, out supplement or out medicate stress. So it's so important that we learn how to manage that because it can wreak havoc on a lot of things in the body. I'm going to add a question in here that we probably didn't prep you for, but is it possible for someone to switch in between Hashimoto's and go from hyper to hypo? I've seen it, usually not typically from hypo to hyper, but from hyper to hypo. So I'm curious, because you've written books on both, and then do your protocols or the natural protocols, differ?
Yeah, that's a great question. So, I've seen both. I agree that it's more common for someone with hyper to make the switch to hypo. And I mean, I will say that a lot of people have the antibodies for both Graves and Hashimoto's. And so if someone is dealing with hyperthyroidism, if the Graves disease is predominant, but in the background they have the thyroid peroxidase antibodies and or thyroid globulin antibodies, that over time that could be damaging the thyroid in the background, and the person can make a switch from from hyper to to pretty much from Graves to Hashimoto's. But I wouldn't say it's really the switch from Graves to Hashimoto's, because they had, who knows how long they had those Hashimoto's antibodies
Yeah.
for, but they presented as hyperthyroidism initially, but then over time became hypo. And I've seen a few people the opposite, but usually with that, it's like where they're seeing me now, let's say for Graves, and then like 10 years ago, they said they were diagnosed with Hashimoto's and they've been managing that, and then all of a sudden they, maybe they're on thyroid hormone replacement and they realize they're becoming hyper and they think it's related to too much thyroid hormone, but then the doctor does further testing and realizes that they have Graves. And then as far as treatment, another question you asked, well, is the treatment the same? I mean, obviously the symptom management aspect is different when it comes to hyper versus
Mm-hmm.
hypothyroidism. But from an immune system standpoint, very similar. It's really just about, incorporating the foundations that we spoke about, diet, stress management, sleep, and then again, addressing the triggers, the food, the stress, the
Mm-hmm.
chemicals, infections. So, I mean, definitely a lot of overlap when addressing the autoimmune component of Graves and Hashimoto's.
Yeah. Yeah. So I know we've talked about a lot, but if someone is listening to this and suspects maybe they have a thyroid issue, or maybe they just got a diagnosis with their thyroid, what is a single most empowering first step they can take?
I mean, the single best, like if they've been diagnosed with a thyroid or autoimmune thyroid condition,
Mm-hmm.
I mean, definitely I would say incorporate the foundations. But I will say with hyperthyroidism, you want to be safe. Not to say in
Mm-hmm.
Hashimoto's you don't, but again, if you have a resting heart rate of 100 beats per
Yeah.
minute or 120 beats per minute, before incorporating the foundations, you probably either
Mm-hmm.
want to, if you have to be on the antithyroid medication or take an herbal approach like I did. I took herbs, bugleweed, and motherwort. So that would be, I would say, number one is be safe. And then right after that, I would say address the foundations. And then again, you
Right.
might go beyond that, but those are the first two steps, I
Yeah.
would say.
Awesome. Well, we've talked about a lot today. I'll wrap it up with one question that I ask all my podcast guests. What would be your best or favorite health tip that you could share with the audience?
Okay, I'm going to deviate a little bit because the easy way out is just to say block out time for stress management, which probably
Yeah.
should be number one and is commonly based on our discussion. But I'm going
Yep.
to deviate a little bit and say omegas, like just
Mm.
make sure you have healthy omega 3s, just because if you're not eating fish on a regular basis,
Mm-hmm.
and again, I know there's controversy. Should we be eating fish on a regular basis with all the toxins? But if you're not eating fish a few times a week at least, and you're not supplementing with a fish oil, you're probably deficient in omega 3s. And, I see a lot of people come into my practice where, they're not eating fish. They might be eating fish once or twice a month and not supplementing. And then we run an omega 3 index, which I don't do on everybody, but if they need convincing that they're deficient,
Yep.
they'll run an omega-3 index, and almost always they're low if they're not eating fish regularly or supplementing. So I would say just make sure that you're getting enough omega-3s either from the diet or through supplementation.
Love that. Very, very, very important. Well, Dr. Eric, it's been wonderful chatting with you. We'll make sure to have all your links in the show notes. Your website is savemythyroid.com. We'll have a link to your podcast, Instagram, Facebook, YouTube, all the things. Is there anything else that you want to add before we sign off?
No, I think that's it. I mean, just I guess the last thing is that there's hope. Whether you're dealing with
Yeah.
Graves' disease, Hashimoto's, or even a non-autoimmune thyroid condition, there's a reason why you developed that condition,
Mm-hmm.
and there is hope in restoring your health.
Love that. There's always a why and there's always hope. So don't give up, my friends. Well, that's a wrap. We'll see you all again next week. Thank you so much for listening. Make sure to like, share, subscribe, and leave a comment below. And if you haven't done so, please be sure to give us a rating on your favorite podcast platform. Join us weekly as we inspire you to be your best version. For more, follow me on Instagram at dr.erinellis. Until next week, you got this.